Well, here's a staggering figure for you. Over 92,000 Americans died as a result of drug overdose in 2020, according to preliminary CDC data, that is. And for context, that is more than twice the population of Annapolis. Many people continue to struggle with drug use, and mental health certainly plays a major role in all of that. And joining us this morning is Christy Blaylock, Regional Director of the Gaudenzia, which provides addiction treatment and recovery services. Welcome and thanks so much for joining us. Christy, thank you. Can you talk a little bit about the mental health aspects of addiction?
Yeah, sure, absolutely. So there's always this question been of what came first, the chicken or the egg, right? And when it comes to behavioral health, we talk about the same thing. Do you treat addiction first or do you treat mental health first? And those of us in the field have really learned that really you need to treat both simultaneously to make sure that you're treating the person holistically and all together, because there's so many layers of somebody that needs to get well and healthy when you're treating them for addiction and for mental health.
We had run a story earlier that Deborah Weiner had done on this amazing woman, Ayana, who now works with you. And she talked about her addiction coming as a result of some traumatic event that happened earlier on in her childhood. And it was her 22nd time that finally recovery took. That has to be kind of rare.
It's actually not. It's really difficult for someone to maintain long-term recovery the first time because, like I said, there's so many parts of a person that need to be treated. The mental health, the physical health, the emotional, the abandonment, all the things that come along with somebody that either had them predisposition to addiction or was, like you said, a traumatic event in their life that, the addiction was a symptom of. So trauma is huge with somebody who fights with addiction and mental health disorders. And Ayana is just an amazing, amazing testimony to how we know that treatment does work and long-term recovery is possible.
And you know what? I guess I meant more. It was rare that she had the fortitude to keep sticking with that. Because imagine if she had stopped her 21st time. She went that 22nd time and it worked. She is incredible. Tell me about the people that you're seeing who are coming in and needing rehab. Yeah. Oh, absolutely.
So really, there's no person that we could put a finger on that comes in for treatment and for mental health addiction and treatment. We're seeing regular people that we see every single day, but the pandemic has really changed some of that and is now showing us the people who were able to not maybe mask their symptoms, but not really have their symptoms of addiction and mental health prevalent because they were going to work every day. They were going to school every day. Their normal schedules and their normal kind of structure of life really didn't have an impact as much. But then the pandemic happened, people are working from home, children aren't in school. So we're seeing younger people coming in with mental health, depression, anxiety, alcohol and substance use. And then we're seeing the folks that were going to work every day that now the change in their schedule has not been able to mask what they were able to previously hide. So some symptoms have come out that they weren't used to seeing on a regular basis.
And so when people come in for help, there's so much of a stigma around it. Other people might think, oh, they just don't have the willpower to get better. It doesn't have anything to do with that. And it often doesn't have anything to do with a person's desire to want help. What are some of the things that you try to tell them when they come in?
The motivation does need to be there. But again, because people are dealing with so many issues, first and foremost, this is a disease and we need to continue to treat it like we would cancer, diabetes, high blood pressure. People who have other chronic illnesses also have slip-ups and also have struggle with maintaining what their doctors tell them is what you need to do to get healthy and stay healthy. The same thing applies for addiction and mental health. We can have medications, we can have therapy, but really the motivation needs to be there, but the long-term supports and making sure that they have the family, the support networks around them to encourage them and keep them on point is really, really important for somebody. This is a lifelong battle. It is a lifelong disease and it does not go away overnight.
And for someone who thinks that full recovery might not be possible, Ayana is a shining example.
Absolutely. And there's tons of them out there like her. She's amazing.
Awesome. So if someone's hearing this right now and they would like to find some help or they know someone who they really would like to get help, what would you suggest?
Talk to a family member, talk to someone that you trust. Maryland has a fantastic 211 number that you can call. Her